Hello, future mental health nurses. Welcome back to Psych Nurse 101. Today, we are diving deep into a crucial topic for those embarking on nursing placements in the UK, particularly in a mental health setting. So that is safety. So let's explore essential safety measures you need to keep in mind. Point 1. One of the first aspects of safety to consider is your dress code. If your placement provides a uniform, great. Then in that case, prioritize comfort and functionality when it comes to your shoes. If there isn't a uniform, then I suggest you dress professionally, so like smart casual, and making sure it's practical. So you want to avoid accessories that can pose a risk, such as ties, skirts, heels, that sort of thing. You want to opt for clothing that allows you to move freely and to respond quickly to any given situation, whether it be like a medical emergency, for example, or managing aggression. And side note, ladies, some of us, we are curvy. You need to think about maybe wearing loose fitting clothes, just because sometimes some clothes can be tight and that can be distracting for some people. You don't want to bring too much attention, if you catch my drift. Point 2. Awareness of your environment and patients. Alongside dressing appropriately, it's crucial to be familiar with your environment, know the locations of the exits, first aid kits, and the protocols for emergencies like fires. Make sure you're shown around when you start. Also, always listen to the handover. It gives you insight into how the patient was during the previous shift, which can help you better understand their behavior and mental state for your shift. Stay alert and take notes. This will aid in your learning about the patients and their needs. Point 3. Safety alarms. On many wards, safety alarms are used. Make sure you know how they work, how to test them. Always have one with you and do not hesitate to use it if you feel it's necessary. One time I forgot my alarm and there was a patient who was blocking a door, and if she wanted to, she could beat me up. So yes, always have your alarms. It was very awkward. I just had to go along with her psychosis and she left me alone. Point 4. Professional boundaries. Maintaining professional boundaries is critical in our line of work. We are there as healthcare professionals, not friends. This means we need to be careful about the personal details we share. Things like our home addresses, relationship statuses, or even seemingly harmless details like our birthdays can sometimes lead to uncomfortable situations or potential dangers. For example, early in my career, I had a one-to-one session where the conversation led to us sharing our birthdays. A month later, the patient remembered and with an unsettling tone warned me, "Mweya, it's your birthday today. It's not going to be a happy birthday in a minute." At this point, I hadn't even had my handover yet, and my initial thought was she had plans to make my day difficult for me. It later turned out that a serious incident had occurred on the previous shift, which made her words even more chilling. This experience served as a stark reminder of how closely patients can pay attention to what we share and how crucial it is to maintain professional boundaries. Remember, every interaction carries potential implications, so it's vital to prioritize your safety and professionalism at all times. Point 5, effective communication. Communication is key in maintaining safety. Always inform someone about your whereabouts and what you'll be doing, especially if you're having a one-to-one session with a patient in like a private room. And, this is a simple step in ensuring everyone's safety. It's one thing knowing where your patients are, but sometimes as staff, we need to know where your staff are. We could follow an allocation, but sometimes we don't. So just always let people know where they are. They're not worried about you. Point 6, know your patients. Getting to know your patients is not just about building a rapport. It's also about safety. So understanding their unique situations of what's brought them into hospital, their potential risks, their background. So in a mental health setting, it's important to be mindful that some items that are for everyday use can be a dangerous item. And so it's having that awareness of what is accessible to these patients. So it could stem from anything from like a battery, a paper clip, even cutlery. So it's just being mindful. So it's things like if you're giving stuff out to patients, it's remembering to collect things. And if you're not sure, it's confirming maybe with other staff members, are they allowed to have certain items? Just as a reference, that way you avoid potential incidents happening. And it's also important for the patients to have consistency, not that 1 minute they're allowed to have one item, then they can't. Point 7, risk assessments. Risk assessment is an essential skill in mental health care. Patients may express their distress in different ways, and it's important to pay attention to the changes in their behavior or their mood. Sometimes this distress can lead to challenging situations, so it's crucial to think about whether it's the right time to engage or if they need space instead. Focus on creating a safe and supportive environment, both for the patient and yourself. Stay calm, observe carefully, and trust your instincts. If something doesn't feel right, speak up to the team. So that way you're asking for your support and you're getting it early. Understanding these situations gets easier with practice and experience. Point 8, breakaway techniques. Prepare yourself with breakaway techniques, which can help you safely remove yourself from any potentially dangerous situation. If you forget these techniques in a high stress situation, which is very normal, use your voice and create assistance, create a distance, run if you have to. I have. Safety always comes first. Use your alarms. Do what you need to do. Prioritize your safety. Point 9, supervision and independence. While it's important to be supervised, especially in the early stages of your placement, it's equally essential to build confidence and learn to gauge the situation independently while always keeping safety in mind. Now let's quickly recap on the key safety message. We've discussed dressing appropriately, being aware of your environment and patients, using safety alarms, maintaining professional boundaries, communicating effectively, knowing your patients, assessing risk, utilizing breakaway techniques, and balancing supervision and independence. Remember, there are also many additional resources available online and likely through your placement institution that can provide further training and guidance on maintaining safety during your nursing placements, as well as policies within the placement itself. So there you have it, 9 key essential safety measures to consider on your psychiatric placements. Right here on Psych Nurse 101. So if you like these safety tips, hit the like button, share with your fellow student nurses or colleagues on placement, and feel free to subscribe and leave a comment below about your your tips and how you keep yourself safe on the wards. Take care, guys. Bye.